So, today I want to talk about disease, giving up, and masking in New York City. New York City is dealing with three major diseases at the moment. At around the same time that New York got hit with its sixth wave of COVID, cases of monkeypox and polio were also discovered. Now, in a city of approximately 8 million people with a population density of 27,000 people per square mile, one would imagine that after six waves of one highly infectious disease, an outbreak of a disease that has little history in North America, and the resurgence of another disease that was considered all but eradicated, that New York was going to do everything in its power to protect public health. Right? Well, the answer's a resounding no. That said, the messaging around these diseases has been extremely mixed in a way that seems to indicate that the problem is recognized, but everyone's all but given up. It was only a month ago when New York State Governor Hochul created a disaster emergency executive order in order to acknowledge the reality of COVID in the state of New York. We can see here that executive order where she talks about COVID-19 hospital admissions remaining at over 100 new admissions a day, and the state needing to pursue an approach to ensure hospital capacity statewide is able to meet regional needs, and that the state government must support the municipalities and counties in their efforts to facilitate and administer vaccinations and tests for COVID-19 and to prevent the virus from continuing to spread at such rates. Clearly, the virus a month ago was considered to be enough of an issue to order this executive order. Now, this is far from the first such executive order that New York has created over the course of the pandemic. That said, this occurred only months after New York City actually closed half of its testing sites and was planning to shut down even more just before a resurgence of the virus, as test positivity rates were actually on the rise. And we can actually see this in an article from The Gothamist where they say test positivity rates point to the same trend. From mid April through late June, the share of PCR tests returning positive results in New York has been between 5% and 10%. This means that a higher share of people getting tested have symptoms or recent exposures than at prior points in the pandemic when test positivity was closer to 1%. That was the goal that New York was often aiming for, was a 1% test rate in order to maintain keeping open, even in the earliest parts of the pandemic. Now, we can see here that citywide, these are the amount of facilities that had shut down. Data from a selection of weeks in 2022 show that New York City health and hospitals have slowly decreased public testing availability. Bars here represent the number of sites open during a single week. And throughout the entire city, that had dropped from 270 in February down to 139 in June. And that number was expected to go down even further as the coming months were occurring. Now, as of September 12th, the governor's executive order has expired, and there's no word that she's going to renew it. So the question really is, how severe should New Yorkers be taking COVID? On the one hand, you have a situation where cases were rising enough that they needed to declare an executive order, and then all of a sudden the executive order is not necessary, but testing sites have been closed, and you get this weird mix where it doesn't seem to make sense, especially because at the same time that this executive order has been allowed to expire, there are approximately 9,700 new cases daily within New York State, and over 8,000 new cases daily in New York City. Meanwhile, at the same time, there's still a statewide disaster emergency due to healthcare staffing shortages in place. And we can actually see that right here, where declaring a statewide disaster emergency due to healthcare staffing shortages in the state of New York, where the staffing shortages in hospitals and other healthcare facilities are expected to impact availability of care, threatening public health and safety. So this is still on the books in the state of New York. Now, this would indicate that they are acknowledging that COVID's still a problem since this was put into effect primarily because of COVID, yet the COVID emergency was not renewed. And so there's kind of this weird back and forth where, on the one hand, they're acknowledging everything, but on the other hand, they're cutting services and they're cutting access to testing sites. And, nobody kind of knows whether this is being treated as it should be or whether or not it's kind of just being ignored because it's done and people have just given up. Meanwhile, as well, you have these two other diseases at play that both have their own states of emergency in place, while there's hospital shortages occurring. We have here that, according to Reuters, the governor of the state of New York, Kathy Hochul, had declared around late July an emergency in the state over the continued spread of monkeypox. And at the same time, Governor Hochul of New York declared a state of emergency in early September over the growing polio outbreak in an effort to better equip healthcare providers with tools to curb the spread of sometimes disabling virus before it takes further hold in the state. So, right now, what's going on is that you have three major viruses, two of which are currently in a state of emergency, and three of which have been in a state of emergency for an extended, period of time, where they're all being registered as a threat, but none of them are being dealt with on a severe level. The thing is if you have another COVID spike, for example, what's going to happen when they're trying to maintain their hospital levels when you have polio outbreaks as well as monkeypox outbreaks? And on top of all this is happening during the time that schools are reopening, which is obviously just going to enable the spread of all three of these viruses that much more. Now, the fact is that all of this seems just disjointed and all over the place. And there's one reality, though, that I want to talk about when it comes to all three of these diseases. They share one trait in common, namely that they can be spread through the air, especially when people are in close proximity to each other, because they can all be transferred via mouth. Now, we have here that we know this about COVID already, but with polio, polio virus only infects people if it enters through the body through the mouth, and it spreads through one of two ways. Usually, it spreads with contact with fecal matter of an infected person, or it can transfer in less commonly, through less common means, of droplets from a sneeze or cough of an infected person. To get infected with poliovirus, you literally just have to come in contact with fecal matter, which, if you're on a train or public transport, somebody could transfer that onto the pole. You touch that, you touch your face. It can easily spread. It's just by touching your mouth after touching something else that's dirty without washing your hands. So that can be really easy to transmit. And furthermore, with monkeypox, it also transfers via respiratory droplets of or oral fluids from someone with monkeypox, particularly for those who have close contact with someone or are around them for a long period of time. Now, all of this comes out of the US, but I want to specifically show that the UK also is collaborating with this and saying that it's the exact same thing. And it's even more specific that coughs or sneezes of a person with monkeypox, when they're close to you, can actually spread the virus. Now, what's the reason I bring all this up, and the reason that I think this is important to mention, is we already know something that is meant to work to stop the spread of viruses through the air or those that are spread through any sort of coughing or sneezing. That would be masks. So, of course, New York wouldn't do something silly like end its mask mandates while there's 3 states of emergency in place. Right? Right? So not only did New York end their mask mandate, they released a sign in their mass transit system that completely disregards how to properly wear a mask. Now, the original mask mandate had come with these particular signs, where if you didn't wear the mask properly, nope, not quite, try again, and that's the one. Stop the spread, wear a mask. It's a fairly effective sign to show people that this is how you properly wear a mask. And it was really useful at the beginning of the pandemic when people weren't used to having to do this. Well, they just released this sign. Masks are encouraged, but optional. If you wear it over your face properly, yes. If you wear it under your nose, yeah. If you wear it on your nose but not covering your mouth, you do you. If you don't want to wear a mask, Yes, let's respect each other's choices. This is atrocious, and it needs to be said. You do you is not public health. Look, I get that because of how politicized masks had become, because of everything that's happened, that not everyone was listening to or following these mandates and proper protocols from the get go. But this is not something that should be being encouraged by the state. Let's respect each other's choices is something we say about food preferences, not how a mask is supposed to sit on your face. That is backed by medical science, especially, in a situation where people's lives are at risk from three different diseases, and it's been acknowledged that there's staffing shortages at hospitals. This is not the proper way to handle any sort of virus that's being transferred, let alone three of them, especially when you have the reemergence of polio of all diseases. And I can't believe that needs to be said, but we need to stop the spread of polio in New York City because it's such a hub for most of the rest of the world. Trade with New York happens all the time. So there's a chance that it might spread to other cities and parts of the globe, and that's really dangerous. Now, in the end, it really does feel like no matter how much New York recognizes the problems that exist here, it's all but given up on actually trying to prevent the spread of these diseases. It can monitor wastewater, it can do all these different things, but if you're not addressing the way that people are masking, if you're not actually dealing with the problem at hand, you're just going to enable the spread of the virus. And the fact is, this is the new normal in which we're just going to accept that people get sick and that people die, because we cannot be bothered to try to fix the problems at hand. In fact, New York City's kind of given up. That said, I imagine that when the seventh wave eventually hits New York City of COVID, there's going to be another statewide emergency, and I bet they will not bring back any sort of mask requirements. That said, I hope you all remain vigilant, and I hope you all continue to wear masks, especially if you happen to be somebody from New York City. And try to stay as safe as you can out there, because wherever you are, New York is far from the only place experiencing this kind of response with their masks, and this kind of response with just giving up and trying to adapt to a new normal by just letting people suffer and die, by telling people they don't have to wear masks. This is ridiculous that we cannot accept after 2 to 3 years that these masks actually do have a positive impact on saving lives, especially the immunocompromised and those who are most vulnerable to disease. So with that said, if you've enjoyed what you've watched here today, consider liking the video, subscribing, as well as leaving a comment, and joining my Discord. On the Discord, we have tons of political conversations like topics like these, as well as more chill conversations where we can just vent and deal with the realities of what's going on at a pace in which we're able to. As well, if you're in a financial place to do so, and only if you're in a financial place to do so, please do consider supporting me on Patreon, especially as political content like this can often be demonetized by YouTube. The links for everything that I mentioned are in the description down below, and with that said, my name is Anarchist Tara. Thank you so much for watching.